Indeed, dementia is the big challenge in our aging societies, and luckily it's not only age and genetics. Dementia is not part of normal aging. It's very important to remember that, and luckily we can do so much already today to reduce the risk. We know now that at least 40% of all dementias are linked to modifiable risk factors. And what we did in the finger trial, it was the randomized controlled trial, so it's the highest level of evidence. So we put together different risk factors. So targeting several risk factors at the same time, we thought we have enough power to really reduce the risk. So it's easy to remember. It's 5 fingers. First one is healthy, balanced diet. Our brains really need nutrition during the whole life course. Second finger, physical exercise. I would say it's one of the most powerful medications we have for the brain. It increases the blood flow, it affects many different transmitters and biomarkers, so it's very, very important for the brain health. Third one is mental stimulation, activating our brain. And here we have so much new knowledge about the brain plasticity, how we can increase the brain reserve, and simply trying to make brains more resistant against Alzheimer and other kind of lesions. Then fourth finger is the social activities, so important for the brain health and well-being. And part of the social activity is also the relaxation, sleep, stress management. And the fifth finger is taking care of all vascular risk factors: blood pressure, cholesterol, obesity, diabetes. What is good for the heart is good for the brain, and this is more also the holistic care. We know also it's never too early to start to prevent, but luckily it's never too late either. You can always do something for the better brain health. In the finger trial, we had very promising results. The risk of cognitive decline was significantly reduced in the finger group, and on top of that, it was not only cognition. There was better functional level, better quality of life, and even the risk for stroke was reduced by 20% and multimorbidity by 60%. So it's the brain health, general health on individual and a societal level. And I'm very happy for the partnership we are having, because now we are having the worldwide fingers with 60 countries where we can adapt and further develop the finger model so that it can really fit to different societies. And as part of that, we are upgrading finger to finger 2.0, which is even more individualized, and we can combine the lifestyle with new treatments when needed, so that the right person get the right treatment at the right time. So we are moving to the precision medicine. So I'm very excited for the future, what opportunities we have with joint forces to really make a great impact on better brain health globally.
So how is it that working in 60 countries, one can actually vary the study or ascertain the different variables in each of these different cultures and among men and women and among different racial groups? How are you doing that?
And this is, I think, the beauty in the worldwide fingers. We have had lack of diversity in many of our studies. We know that dementia is increasing even more rapidly in low and middle income countries. So we have the opportunity to have more diverse populations. We have support from Davos and DAC to have the harmonization. So we try to harmonize the protocols that we know what the lifestyle factors are. We are collecting blood-based biomarkers that we can understand and analyze the underlying mechanisms. So I think there is power in this diversity to have really more knowledge. What are the underlying mechanisms? What is the best recipe for reducing the risk of dementia?
So what's exciting about this is the ability to gather this data in a systematic way and then put it into a common database so that researchers all around the world can have access to the same data and make some judgments about it.